Hello everyone, welcome back. Today we are going to start new clinical case scenario series. So let's get started. Here you can see the MCQ number 41 on your screens. A therapist is working with a new spinal cord injury patient who has the complete injury of T4 level. So the patient on getting the wheelchair for discharge, what is the best feature for this chair? Option A, the power wheelchair with the tilt in space for patient relief. Option B, power wheelchair for community use with a lightweight manual chair for household and short distance. Option C, manual wheelchair for the community use and the loft-stand crutches and orthoses for the household ambulation. And the option D, manual wheelchair with pressure relief cushions. And the correct answer is option D, manual wheelchair with pressure relief cushions. And here we have the explanation. A patient with the T4 spinal cord injury should be able to perform the manual propulsion even for community use. So the powerful wheelchair is not appropriate. The patient will be unable to ambulate any significant distance, therefore the manual wheelchair for the community use and the loft-stand crutches and orthoses for the household ambulation is not good choice. Moving toward another scenario. What are the appropriate precautions to use with the patient with disseminated herpes zoster virus in acute care? Option A, gloves. Option B, gloves and gown. Option C, gloves, gown and mask. And option D, isolation in negative pressure room. And the correct answer is option C, gloves, gown and mask. Here we have the explanation. The patient with the herpes zoster viral disease would require the droplet precaution, for which we use gloves, gown and mask in the room. Moving toward another scenario. A 4-year-old child with the spina bifida occulta at the level of L5 is beginning to ambulate. So which of the orthoses would be the best option to address this child's gait deficit? Option A, knee ankle foot arthrosis. Option B, dynamic ankle foot arthrosis. Option C, rigid ankle foot arthrosis. And the option D, supramellular arthrosis. And the correct answer is option C, rigid ankle foot arthrosis. Here we have the explanation. Based upon the child's level of occulta, the lack of dorsiflexion should be the biggest deficit. So the knee ankle foot arthrosis would be excessive and the SMO, supramellular arthrosis, would be too little to support. So we will consider the rigid ankle foot arthrosis for this child. Moving toward another scenario, when using the dexamethasone in anaphylaxis, it should be option A, placed on the cathode as dexamethasone is a positive charge. Option B, dexamethasone placed on the anode as dexamethasone is negatively charged. Option C, placed on the anode as dexamethasone is positively charged. And the option D, placed on the cathode as dexamethasone is negatively charged. And the correct answer is option D, placed on the cathode as dexamethasone is negatively charged. Here we have the explanation. As we all know, the like charges always repel each other and opposite charges attract each other. So in the case of anaphylaxis, it is desired for the medication to flow toward the area of concern. So therefore, a negative charge medications such as dexamethasone should be placed on the negative cathode in order to flow toward the positive electrode. Moving toward the last MCQ of this part, a patient you are treating with the Addison disease arrives at the therapy, is visibly distressed and report that she has been vomiting and have diarrhea for the last 2 days. She states that the pain in her back and the leg is unbearable now and that she has been blacking out. Now you assesses that the patient vitals and find her blood pressure to be much lower than previous session. So what will be the best course of action is to? Option A, send the patient home to rest, instructing her to call her doctor if the vomiting persists due to risk of dehydration. Option B, assist the patient to decide to get to the nearest emergency room as she is exhibiting the sign of acute adrenal failure. Option C, refer the patient to her primary care physician for an MRI due to an increase in back and leg pain. Option D. Recommend the patient to drink some Gatorade and perform seated and supine exercise monitoring the vital throughout. And the correct answer is Option B. Assist the patient to decide to get to the nearest emergency room as he is exhibiting the sign of acute adrenal failure. Here we have the explanation. In the case of Addison disease, there is an adrenal disorder. So the patient is showing the sign of adrenal crisis. So the emergency medical care should be needed. So that's all for today's part. Thanks for watching.